The diagnosis of cancer is something we never want to hear. Some of us have been given a diagnosis of cancer, or maybe some of us have lost a loved one from cancer. This is why it's so important to recognize the many signs and symptoms a woman could develop, because if cancer is recognized early, the outcomes can be much better in most cases. The good news is, in this video, I'll go over some of the most common signs of cancer in women and also discuss some different symptoms of cancer in women. Both are very important, signs and symptoms. So you definitely don't want to miss these warning signs, because one day it may not only save your life, but it may save a family member's life. With that being said, let's dive in. Welcome back, thanks for watching. If you're interested in supporting my channel, give me a big old like and subscribe below. Otherwise, maybe next time. Diving straight in, the first thing women don't want to miss is any breast changes, like any masses that are palpable or felt in the breast tissue or underneath the armpit. That needs to get evaluated. A lot of times these are benign in nature, like they're fatty tissue, but it's very wise to get these evaluated as quickly as possible. Also look out for any nipple discharge, nipple discoloration, pitting of the breasts, and also sometimes rashes around the breast area could be a sign of cancer. All of these are signs of breast cancer, and this is a very common cancer in females, so it's very important for a woman to understand their breasts, how it looks and how it feels, because if there's any changes in the breast tissue, it's very important to follow up with your primary care provider and get it recognized and evaluated. The next concern is what we call B-type symptoms, also called B symptoms. These symptoms are concerning for various types of cancers like Hodgkin's or non-Hodgkin's lymphoma. These symptoms can include 3 different symptoms. You could have 1, you could have 2, or you can have all 3. And this includes any unexplained fevers, drenching night sweats, meaning you wake up and your bedding is completely soaked, or you can also have weight loss of 10% or more in less than 6 months. Again, all of these things are unexplained. Sometimes I have patients and they're like, I feel warm sometimes, or I sweat in my sleep on occasion, or hey, I lost some weight recently. But remember that a legitimate fever is above 100.4. Also remember that people sweat in their sleep, but they're not waking up with all their linen drenched. Also remember that a lot of people intentionally lose weight through different exercise and diet regimens, so this is explained, not unexplained. The third major concern for cancer in women is abnormal vaginal bleeding, and this is a big one. Concerning vaginal bleeding can include bleeding between menstrual cycles or periods, bleeding after intercourse, or also vaginal bleeding in postmenopausal women. This type of vaginal bleeding can be concerning for endometrial cancer and also cervical cancer. But you also have to remember that not all abnormal vaginal bleeding is cancer, and it's usually benign in nature, but it should always be addressed. The fourth potential concern for cancer in women is persistent pain in the pelvis or abdominal region. Women can unfortunately have bloating, swelling, pain, or sometimes some women can feel a mass in the abdomen or pelvic region. These all can be potential signs of endometrial cancer, colon cancer, or even ovarian cancer. The last potential symptom that we're going to talk about today that could be a concern for cancer is any changes in bowel habits. Some things that are concerning is any persistent diarrhea or any persistent constipation could be a problem. But also keep in mind that everybody's bowel movements are a little bit different, meaning some people have a bowel movement maybe twice a day, but other people may only have 1 or 2 bowel movements per week, and that's normal for them. So what we're looking for is any changes in people's normal bowel movement routines, meaning they're starting to have blood in the stool, any changes in stool consistency, any type of persistent abdominal or pelvic pain like we talked about earlier. These may be concerning signs or symptoms. These can all be signs of various cancers, but especially colon cancer. In the United States, we do a great job of screening for various cancers in women, like cervical cancer and breast cancer. And I bet most of you don't know anybody who's passed away from cervical cancer, and the reason why is because we catch them early through pap smears. But globally, globally, hundreds of thousands of women die annually from cervical cancer. In the United States, only a few thousand. I only say only because it's a low amount, because each death is incredibly sad, but it's definitely low compared to other countries. I actually had a family member die in the Philippines in her 30s due to cervical cancer because she was unable to get these routine pap smears that we take for granted here in the United States. So always get your pap smears, they're very important. Additionally, screening mammograms are incredibly important in catching breast cancer early. So if your provider is recommending getting a mammogram or a pap smear or a colonoscopy, definitely consider getting these because these save lives. That wraps up today's video on the signs of cancer in women. If you enjoyed this video and you want to support my channel, please like and subscribe below. Otherwise, until next time.